Hi friends, I am Dr. Pratap Singh Rathod. I have done MD in Forest Medicine, and today we'll continue with regional injuries. In that, we'll discuss about injuries related to neck and spine. Neck can be a site of many different types of injuries due to presence of large number of vital structures, and it can be easily grasped and held. Fractures of higher bone thyroid cartilage may occur due to falling injury and injuring the neck, and it can be caused by because of handlebar of the cycle or by dashboard of the motor car. Fracture neck by blunt force can cause spinal cord concussions, which may lead to railway spinal whiplash injuries, or it can cause lacerations of transsectional spinal cord. A blow to the side of the head or a face may lead to laceration of vertebral column. A blow on the front of the neck may cause unconsciousness or even death due to vehicle inhibitions or fracture of larynx. Suicidal incident wounds are more common compared to homicidal incised wounds. Puncture wounds are usually homicidal in nature. So these are different types of neck injuries. Mainly, any road traffic accidents are related to vertebral column injuries compared to any punch incised wounds, which are usually suicidal compared to homicidal, which are puncture wounds. Medical significance of neck injuries. Medical examination of neck wounds can give a clue regarding motive of wounding, whether it is suicidal, homicidal, or accidental injuries. So any injury in the neck should be thoroughly investigated to know whether those injuries are because of suicidal, homicidal, or accidental injury. Now coming to next organ, which is vertebral column injuries. The spine is commonly injured in major trauma such as road traffic accidents and fall from height. The type of injury depends on the degree of force and angle at which the spine is struck. Fracture of vertebral columns are caused by direct violence, as in direct injury to the vertebral column, or indirect violence, as by when the person invariably bears weight on the vertebral column, like bending the body, or by fall on the buttocks of it, which can direct the force towards the vertebral column. Force applied to spine may result in damage to the discs or the vertebral bodies. So each vertebral bodies are each arranged, and the force when applied may cause the discs to prolapse or may get fractured. Hyperflexion is the most common mechanism of fracture of the spine. The common site of fractures are upper and lower cervical regions, and junction of thoracic and lumbar segments are the most common regions where fractures of the vertebra occurs. Now coming to injury part of the vertebrae, so each vertebrae has transverse process, vertebral bodies, spinal processes, etc. So each has different injury may occur. Fracture of transverse process of vertebrae. These are seen mainly in regions of lumbar spine, where the quadratus lumborum muscles is attached, and because of traction of those muscles, there is commonly transverse process get fractured. Then fracture of vertebral bodies. It is seen mainly in the compression or wedging of vertebral bodies. So each vertebral body may come in contact with each other and may lead to fracture of the vertebral bodies. Commonest is the thoracolumbar lumbar spine. Injuries of atlas axis of the first two vertebrae are more dangerous than lesions in the lower cervical vertebrae because of involvement of respiratory centers in those areas. Then fracture of spinous processes. Spinous processes may be fractured by direct trauma, that is directly over the spinal process, or by indirect violence by muscular pull. So indirectly, that muscular attachment to the spinal process may get tracked and lead to spinal process fractures. Then fracture of lamina, they are usually caused by direct trauma over the lamines. Fracture of pedicles and articular processes, they result from direct blow directly over the injury on the pedicles or severe fall upon the edge of some objects. Articular process may also be fractured due to severe strain of the lumbar spine. Now coming to injuries to spinal cord can be injured by fracture or subluxation of the spine, or it can be also injured by penetrating injury wounds. Spinal cord injuries may be concussions, compression injuries, pitting injuries, lacerations, and contusions. Coming to concussion of spinal cord, they can be railways. There are two types mainly. That is, one is railway spine and whiplash injury in the concussion of spinal cord. Railway spine, it is maybe caused due to some momentary collision of the cord against the wall of the canal, or tangent deformity in the profile of the canal due to violent acceleration, deceleration, or rotational strains. So mainly, the spinal cord which is present in the inside of vertebral column may come in contact with the walls of the canal, or because of acceleration and deceleration of the spine, the spinal cord can be injured because of that railway spine occurs. Common cause of railway spine are the railway motor collisions, severe blow to the back, compression from dislocation or fracture of vertebrae, damage by effusion of blood, fall from height, or any bullet injury may all lead to railway spine injuries. Symptoms appear immediately or some hours afterwards includes headache, giddiness, restlessness, sleeplessness, neurasthenia that is weakness in the limbs, amnesia, loss of memory, loss of sexual power, derangement or special senses may also occur. It also produces paralysis affecting the arms and hands or bladder, rectum, or lower extremities. Paralysis temporary and may occur in 48 hours. Next type of spinal cord injury is concussion injury is the whiplash injury. So whiplash injury is a type in which acceleration, deceleration mechanism of energy transfer to the neck that may result in the bone and soft injuries. So violent acceleration and deceleration of the neck, that is hyperflexion and extension of the neck, may lead to fracture of the spinal cord, which leading to whiplash injuries. Commonly seen in road traffic fatalities, which are due to hyperextension of the neck. Hyperflexion injuries are less likely but may be caused if heavy weights are dropped on the bent back of the individual. So, in whiplash injury, the head is violently flexed and extended, which lead to strains in the spinal cord leading to whiplash injury. The injury is sustained commonly by occupants of the front seat in motor vehicle accidents. Causes of whiplash injury: rear end or side impact motor vehicle collisions and sometimes in the front impact collisions, blow on the chin, blow against the spinous process of the upper cervical vertebra, that is also called as rabbit punch, may all lead to whiplash injuries. So, sudden stoppage in the vehicle accidents may cause the neck get hyperflexion as well as hyperflexion, which is causing the injuries. It can also cause in side impact injuries where the head may get sideways, get and flexed and hyperflexed and hyperextended. Mechanism of whiplash injuries: abrupt acceleration of the trunk causing the whip-like movements of the head is the warnish cause. That is, the head is whipped like a whip, leading to whiplash injuries. Can also occur in rear end collisions causing a maximum unchecked backward thrusting of the head followed by forward rebound. So any collisions leading to maximal head one movement in one direction, rebound of the other direction may lead to whiplash injuries. In case of side impact collisions, the cervical spine will be forcibly bent in the frontal plane or in the intermediate plane, that is frontal or sagittal plane. It is bent, leading to whiplash injuries. Signs and symptoms of whiplash injuries: mainly there is pain and stiffness of the neck and lower back immediately after 24 hours of trauma. There is headache, dizziness, tinnitus, vertigo, irritability, nausea, fatigue, blurred vision, numbness, tingling, pain in the arms, legs, feet, hands, difficulty in swallowing, pain between shoulder blades, concentration, memory problems are present, the psychological problems are also present. At autopsy, there will be facet joint, that is the cervical zygofacial joint, yellow ligament, uncoverted vertebral, and disc endoplate lesions may be seen. An area of hemorrhagic discoloration on the surface or in substance of the cord or subthecal equation of blood may be found. So mainly hemorrhagic concentration will be present in the spinal cord. Medical aspects: a rising percentage of car accidents results in a refund claim based on the whiplash. So many of absence of airbag opening may be claimed by insurance to leading to whiplash for claiming as whiplash injuries. This is partly due to increased awareness and documentation, though few false claims cases are also present. Infant whiplash or injury syndrome is a condition which occurs in infants where the body is shaken uncontrollably. A trauma suffered by small children as a result of deliberate abuse, also known as shaken baby syndrome, in which baby is shaken in the sense that the head is moving front and back, where the neck traction is not yet found. The head may move front and back, leading to whiplash-like injuries in the infants. Infants may suffer neurological impairment, seizures, hemorrhages, and contusions of the high cervical cord, all of which contribute to fatality. Next type of spinal cord injury is the compression injuries. Compression of spinal cord usually occurs due to fracture dislocation, usually at the level of C4, C6, T3, T6, T10 to lumbar L3, etc. Victim may die in 24 hours or survive with permanent paralysis. So compression injuries mainly occurs in the because of fracture dislocation. Because of fracture, the spinal cord get compressed between the bone and the vertebral column and the canal. Next type of spinal cord is the pitting injuries, which is a killing of by pushing a fine needle into the nape of the neck between base of the skull and first cervical vertebra, and it is a type of concealed puncture wound. So in this needle-like object is placed between the base of the skull and the first cervical vertebra, leading to killing of the person. Then there is laceration of spinal cord. Laceration may occur because of twisting of the neck, which lead to laceration of spinal cord, which in turn can lead to death without any evidence of external injury. So twisting of neck may cause lacerated spinal cord get lacerated and person may die because of that. Example like killing unwanted children, causing to infanticide. In case of wrestling, in case of firearm injury, may also cause spinal laceration even without when the missile is not yet entered the cord, but just be touched the neck. Next is the contusion of spinal cord. Contusion of spinal cord may occur from direct or indirect ones. Direct being directly on the vertebral column, indirect being when the person falls on the on the feet and the force is transmitted on the vertebral column. Mainly because of that, hemorrhage may occur in the canal and compress the leading to contusion. The hemorrhage usually extend the axis of the cord, that is along the spinal cord. The hemorrhage occurs. Bleeding may occur either in the spinal meninges, that is called as hematotaxis, or in the substance of spinal cord, that is called as hematomelia. So either there is bleeding in the spinal meninges between the dura and the spinal cord, or within the spinal cord, that is called as hematomelia, and the symptoms or signs are similar to that of concussion of the spinal cord. These are my references. Thank you.